Screening questions are used to determine if a client views him or herself as a religious or spiritual person and what their core religious and spiritual beliefs and practices are. Most of the U.S. population identifies with a religion, in contrast to many countries such as in Europe. To set a context, here are some important descriptive statistics about religion and spirituality in the USA. 7 in 10 Americans identify with some branch of the Christian faith. An increasing number identify with non-Christian religions. The share of Americans who identify with non-Christian faiths has been increasing, rising to 5.9% in 2014. Growth has been especially great amongst Muslims and Hindus. The percentage of Americans who are religiously unaffiliated, describing themselves as atheist, agnostic, or nothing in particular, unaffiliated with any form of organized religion, has been growing and is now almost 1/4 of the U.S. population. There are now approximately 56 million religiously unaffiliated adults in the USA. This group, sometimes called religious nuns, is more numerous than either Catholics or mainline Protestants, according to a Pew Foundation survey. Yet more than 1/3 of people unaffiliated with a faith tradition classify themselves as spiritual but not religious. 2/3 of them say they believe in God. More than half say they often feel a deep connection with nature and the earth. With people who self-identify as atheist, agnostic, secular humanist, or just uninvolved and uninterested in religion or spirituality, as well as with persons who do not identify with Christianity, it is important to use terms that do not have a Christian connotation. The words church, prayer, worship, Bible, sacraments, and God, when used with clients who do not hold a belief system that includes these elements, could create a barrier to building a therapeutic alliance. The ESOP interview provides alternative words such as faith, spiritual community, spiritual practices, meditation, spiritual literature, and higher power or force. However, with such individuals, you can ask questions to identify alternative sources for meaning. Note that the first question does not specify religious or spiritual beliefs. Instead, it asks, what helps the client cope? Do you have any beliefs or practices that help you cope with difficulties or stress? Many clients will spontaneously mention religion or spirituality, but if they don't, you can ask a more direct question. For some people, their religion and/or spirituality are a source of strength and comfort in dealing with life's challenges. Are they for you? If they answer no, you can probe to see if there is possible interest based on the client's past experience. Were they ever? If both answers are no, ask, what are your sources of hope and strength when you face life's challenges? Many of the following ESOP questions can be rephrased to alternative sources of meaning. Often, the answers to the screening question reveal a specific religious organization, such as a church, or a specific personal spiritual practice, such as walking in nature. You can then follow up with additional questions from the ESOP sections on organized religion and spirituality, or personal religious and spiritual practices.